Hi, my name is Rachel Kelly, and I am sharing with you my discharge plan for a patient who is prescribed a CPAP or BiPAP machine. A BiPAP machine is a bilateral airway pressure machine, and a CPAP machine is a continuous positive airway pressure machine. Both of these machines can be prescribed for patients that are experiencing COPD, chronic obstructive pulmonary disease, obstructive sleep apnea, maybe upper airway resistance syndrome, snoring, obesity, which can cause hypoventilation, asthma flare-ups, pneumonia, poor breathing post-op, altered breathing of any kind, but neurological disease that disturbs breathing, upper spinal cord paralysis, and obstruction in the airway can all be cause for a prescription for a CPAP or BiPAP machine. The difference between the BiPAP machine and CPAP, as you can tell by the names, the BiPAP machine is a bi-level airflow machine, so it's giving you two different levels. One for inhalation, which is a little bit higher pressure, and then the exhalation component is a little lower pressure. And this aids the breathing of the patient, making sleep more restful, whereas the CPAP machine is just one continuous airflow. So when you're teaching a patient how to use this machine who may be new to it, there's going to be a learning curve. It can be very uncomfortable to get used to. There's three components to the machine, and it is made up of the motor, a hose, and then a mask that is connected to your head by a strap. So the motor can be loud, or it can be loud at first, and it can take some getting used to, and the mask can be a little uncomfortable to get used to also, but it should get easier with time. You may need to adjust the pressure if you're having issues with breathing. If you feel like it's uncomfortable, you can reach out to your medical provider and consult them. You should do that. No food or drink while you're on a CPAP or BiPAP machine. You're going to potentially need a humidifier in your room, or some machines actually have a humidifier in the motor, and that'll help with nasal dryness. A leaky mask, skin irrigation, and pressure lines may indicate a need for a change in mask size, or they could be that the straps are incorrectly applied. It can be a little uncomfortable at first, and you're going to want to be empathetic with that. So there are, when assessing a patient with CPAP or BiPAP machines prescribed, you're going to look at their level of consciousness, their pulse ox, their respiration rate, which includes the effort and pattern of their breathing. You're going to look at their heart rate. You're going to evaluate their compliance to the therapy. And if you see anything unusual, like accessory muscles being used to breathe while they're on the machine, you're going to want to note that. The diagnosis for a patient on CPAP or BiPAP could include risk for noncompliance with therapy, or a risk for inadequate, and a cause for needing the treatment in the first place would be risk for inadequate gas exchange related to COPD or inadequate breathing post-op. The plan for a patient that's being discharged on a BiPAP or CPAP machine is going to include teaching them how to keep the machine clean, teaching them what to look for in terms of negative side effects, ineffective gas exchange, and you're also going to want for them to plan to have regular ABGs done. That's arterial blood gases, to make sure that the CO2 and the H2O is being exchanged at the adequate rate. Machines includes teaching them how to keep the machine clean. They're going to need to clean the circuit of the machine weekly, the mask daily. They need to refresh the O2 daily, and they're going to want to use sterile bottled H2O for irrigation. You're going to want to educate the patient on some of the negative side effects of a BiPAP or CPAP machine. These are not life-threatening, but they can be an issue. They can create an issue of compliance for the patient because they are uncomfortable. Aerophagia is the swallowing of air. This can lead to flatulence, bloating, burping, and discomfort. It's usually mild, but there are always severe cases. You have the potential of developing a local skin damage from the mask, so you're going to want to monitor the skin integrity of the mask area regularly. And you could also develop dry mouth, eye irrigation, sinus pain, and congestion. You might want to advise your patient to have purchase humidifier if they do not have one, or see if they have a machine that has one included. So the implementing process would be completed by doing this teaching, and then having the patient repeat back to you what they need to do to keep the machine clean, how they're going to use the machine, signs and symptoms that they're going to be looking for to make sure that they are receiving the treatment they need. You're going to want them, whether it's the patient themselves or also family members that support them, to evaluate the compliance they feel with the therapy, whether or not they see themselves being able to do this. When evaluating how your care plan might in terms of discharge, you're going to want the patient to be able to list the signs and symptoms of respiratory alkalosis, so dizziness, lightheadedness, confusion, dry mouth, bloating. These can be similar to some of the symptoms that will be expected with the machine, so they're going to want to really pay attention to things like discomfort in the chest area or numbness and spasms in the hands or feet. The patient will also be prepared to be having normal blood work done for their ABGs. That'll be at the provider's discretion, but I would say monthly ABG blood work. And you would also evaluate that the teaching went well by having them relay the information and demonstrate to you how they would clean their machine, use their machine, turn their machine on and off, set the pressure, and put on their mask and straps. You want to make sure your patient feels comfortable going home with this machine and using it nightly. Even though it is going to be a learning curve, you want to make sure they're prepared.